Together we are strong. We will overcome. When we work together, we can accomplish anything.
Dr. Marjorie Roberts has a doctoral degree in business. As an admin and founding member of MaskTogetherAmerica, Dr. Marge has been advocating about long COVID since 2020. COVID doesn't discriminate, she taught us. She contracted COVID in March 2020, and it changed her life forever. She could not start a planned life coaching business as her health rapidly deteriorated. She endured organ damage and all kinds of symptoms, including loss of teeth. She faced medical gaslighting, yet she kept moving forward. Dr. Marjorie's signature phrase is, "And yet again, I smile." She never stopped advocating for her fellow long haulers. She shared her story to raise awareness and has been featured in many news articles, including the New York Times and NPR. Please give it to her.
Wow. First of all, giving God all the glory. I must thank Diana, Amy, and Carolyn for throwing me a lifeline when I was drowning in 2020 from COVID-19. Let me thank you all for coming here today. We are all here for a reason, and that reason is to wake up Washington! I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all, except for myself and others suffering from long COVID. Liberty would mean that I would not have been forced into early retirement because everything that I had worked for my entire life was taken away. Liberty would mean for myself and others there would be no necessity for action from the government. Liberty would mean that I would be able to be transparent with how COVID has changed my life forever, my entire existence, without having to be shadow banned on all of my social platforms. Justice would mean when I contracted COVID-19 at my place of employment in March of 2020 and chose to resign because COVID had made me sicker than I had ever been in my life, and I had the nerve to file for unemployment, and it was denied. I fought for that unemployment all the way to the Superior Court in Fulton County, located in the not-so-great state of Georgia. And I lost, and was told the reason that I lost because contracting COVID and deciding to resign from a job was not a good reason to resign. Justice would mean the country I raised my hand for and swore to defend would have defended me when a certain individual elected to run this country suggested Clorox would kill the virus that had killed my lifelong friend, Sergeant Gary Mitchell, an 82nd Airborne paratrooper that loved jumping out of perfectly good planes. Justice would mean that the powers that be would listen to myself and others when we apply for disability and we're told to hire a lawyer. In reality, there's nothing in our refrigerators but the light and a stale box of Arm & Hammer baking soda. Those of us suffering from long COVID didn't choose the loss. We did not choose the pain. We cannot just be expected to move forward in life without liberty and justice and the support of the federal government of the United States. We are losing the battle against long COVID because in order for a battle to be fought, it takes determination, resources, communication, strength, and motivation, all of the things that we do not have because our liberty and justice has been replaced by bondage and maltreatment. We are part of a battle that we are forced to retreat from because of fatigue, brain fog, chronic pain, shortness of breath, chest pain, muscle aches, COVID crashes, dizziness, migraine headaches, and hundreds of other debilitating symptoms. Those of you here in Washington may not be engrossed in helping those of us suffering from long COVID, but long COVID will be engrossed in you and your families for generations to come. The government has all the resources needed to help us fight this battle against long COVID, but the lack of diplomacy and choosing to react and not to respond is again not pledging allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. In closing, I stand here today. I am the voice for the voiceless, the millions of people like myself that have suffered tremendously because of the lack of compassion or concern of what living every day with long COVID really means. I have been advocating 4 years now. In all honesty, I have seen and heard a majority of things from the government that is buried in the depth of my total soul. In this setting today, I have chosen to share with you, I have given all I have to give. I have spoken my truth on every single platform that I could. I'm tired now. So as a first in order, I'm stepping aside to establish a place for the second in order. I have been a temporary Band-Aid, and it is time for the healing to begin for my family. And as we do our very best to navigate our new life. I am asking you all to keep fighting. I stand here today, and as I look out over this setting, I can't help but have flashbacks to when a certain individual stood here one night and made me a promise. You broke your promise. Again, I thank everybody all over the world for your support and your love. Thank you.
Our advisor, Dr. Robi Tamargo, is a clinical psychologist who practices in Jacksonville, Florida. She works as a primary care behavioral health consultant focusing on treating patients aged 18 to 42 who are fighting PTSD. She has been treating many young people who are struggling with multi-organ system diseases that they developed post-COVID. Besides losing her mom to COVID last year, our frontline hero had COVID 7 times. She became immunocompromised because of COVID-19, and she has been battling long COVID to this day. We are grateful that she can make it here today with us.
Good morning, LCDC. I am Dr. Robi Tamargo, a primary care clinical psychologist and United States Navy veteran. I was infected with SARS-CoV-2 in early spring 2020 by a physician who was one of my patients. I'm here today to respectfully ask President Biden, Congress, and the CDC to please recognize this moral and economic imperative and stop turning your backs on this global public health crisis known as long COVID. Here is why. More than 90% of long COVID cases started with mild SARS-CoV-2. The first 3 waves were the worst, but Americans are still contracted COVID-19, dying and developing long COVID today. Scientists, physicians, and at least 7 million Americans, along with untold millions of our voting-aged friends and family members, now know that COVID-19 leaves a profound impact on the brain, known as neuro-COVID. If you love someone who suffers, or you suffer with the most common symptom, colloquially called brain fog, please join me in educating others about our reality. Firstly, it is not brain fog if it continues once you've recovered from COVID. It's neuro-COVID. Since the pandemic began, if you developed new, persistent memory, comprehension, attention, concentration, reading, writing, or word-finding difficulties, you don't have the invalidating, diminishing term brain fog. You have cognitive impairment of neuro-COVID. If you still have loss or altered taste or smell, you have neuro-COVID. If you have new or worsening headaches, seizures, trouble sleeping, tremors, tingling, muscle spasms, or joint pain, you have neuro-COVID. If you have new onset or the worst episode of your life of depression, anxiety, psychosis, or PTSD, you have neuro-COVID. If you've developed Guillain-Barré syndrome post-COVID, you have neuro-COVID. Mr. President, Congress, and governors, I ask you to please familiarize yourselves with newly published research showing our younger adults aged 18 to 44, which happens to be our military-aged cohort. They are having serious difficulty with memory, concentration, and decision-making, which in my clinical world is known as higher cortical dysfunctioning. They have neuro-COVID. Almost 70 million people around the world are suffering with multi-organ system disease of long COVID. So the people with neuro-COVID are not to be minimized. Please remember the words of President Abraham Lincoln and Dr. Martin Luther King spoken here when you ask us for your votes. I will paraphrase. I, and I believe other long COVID sufferers and their supporters, will stand with anybody that stands right. And we will part with him when he goes wrong. The founding promises of America are freedom, equality, and justice for all. Does this include Americans suffering with long COVID? We need your true leadership in stopping the misinformation that is minimizing the long-term adverse neurological consequences of even a single mild infection. And the even more sinister impact of repeat infection, known as neuro-COVID. Please ensure an honest public health education campaign about the risks of long COVID based on recent, well-designed studies by our nation's and the world's scholars. Please provide more funding to expedite approval of effective treatments. There are none. Please provide a streamlined, doable application process for disability that is accessible for all long COVID sufferers, especially those with neuro-COVID. Please Please provide funding for clean air and ventilation in all public buildings, the least of which are hospitals, dentists and physicians' offices, houses of worship, and every school in America. We need this to protect this nation's future, its brain trust, our children from neuro-COVID. Next, I speak to you personally, President Biden. I grew up the child of a Register of Wills of Cecil County. You know where that is. As an ardent supporter of you, she contracted a fifth infection of COVID-19 in April 2023, causing her to be stricken with Guillain-Barré syndrome. Despite being fully vaccinated and boosted, she died in May 2023. All of my life, Mr. President, she told me stories of meeting you. I was just a little girl, and I admired you from her stories. She admired and respected you fervently. I have your election memorabilia all over my house as proof. Please don't abandon her. I am the fourth of 5 generations of those who proudly served in the armed forces of the United States of America. Mr. President, I know you care about the protection of our military and veterans. They need you to protect their careers and ensure appropriate mental health care, especially in the smaller branch clinics. They need proper diagnosis of long COVID so they can receive necessary disability compensation when they are no longer permitted to serve because of the mysterious symptoms that are in their heads. Oh yeah, it is in their heads. It's neuro-COVID. Thank you.
Hi. You can tell I have never done this before. I'm very nervous, but I'll do my best. Thank you, Long COVID DC March, for this chance to speak. My name is Julie Lam. I'm a writer who initiated MaskTogetherAmerica. Since 2020, we have been a COVID advocacy group raising awareness. I lost friends to COVID early in the pandemic. That's how I knew SARS-2 is a dangerous virus. Rain or shine, even during the shutdown, I double masked and took portraits of thousands of masked people to raise awareness to support mitigation. I grieved by taking action. Today, I want to share my story to help people see one important fact. Vax and relax is wrong. The CDC's mitigation strategy is wrong. In 2021, I got vaccinated as soon as it was available because I have IgAN and autoimmune disorder. The second COVID shot triggered an abnormal overreaction of my immune system, causing a relapse, inflammation of my kidneys, and hematuria. Sadly, the vaccines didn't protect me from an infection. In April 2021, if you guys still remember, President Biden announced fully vaccinated people may unmask for outdoor gatherings. When Omicron hit, our government kept saying the new strain was mild. Dr. Fauci told the world in November the families with 2 doses can feel good about gathering for the holidays. But I caught COVID at a Christmas gathering that year, infected by a vaccinated relative who showed no symptoms. I was sick for nearly a month and developed incurable conditions. The experience was nothing like a flu. 5 nights of insomnia, shortness of breath. I couldn't breathe when I lay down. Burning pain in my back came from my kidneys. My kidneys got inflamed from both the infection and the booster I took right after Christmas. My nephrologist, who lost his mom to COVID, took my calls on New Year's Eve, thank God. He got me medication and Paxlovid, sparing me from hospitalization. Later, learning about that millions of people died worldwide from this wave, I cried. A couple of months later, while I was driving, I suddenly felt shooting pain in my eyes. I pulled over in the middle of traffic in Manhattan. I was scared. I started to feel very tired every day. My eyes flare out constantly when I work on my computer. I wake up with sore eyes as if I hadn't slept. My primary care sent me to specialists, including sleep doctors and ophthalmologists, a neurologist, 2 cardiologists, and an endocrinologist. I had 2 sleep studies. And after waiting for half a year to see a sleep doctor, I was diagnosed with sleep apnea caused by COVID. The ophthalmologist said I have severe dry eyes. After 2 years, my nephrologist tested me for Sjogren's. That's how I finally got a diagnosis for my long COVID eyes. And now I see a rheumatologist who said lots of her patients shared my experience. Is the nightmare over now I have been diagnosed? No. Neither condition can be cured. My kidneys lost function. My kidney condition went from stage 1 to stage 2. One medication I need costs over $15,000 a month. My insurance won't cover it. So I signed up for an experimental medical trial, which I have to inject around my belly every week. My rheumatologist fought to get insurance to cover a nose spray to treat my eyes. The med, which costs $600 per month, gives me insomnia. I am a vaccine advocate. I cannot get another COVID booster because of my autoimmune disorder. I share my story today because many people are being gaslit. Patients are getting bounced around in this giant, horrible healthcare maze, lost, exhausted, not being cared for. Instead of educating Americans about using all the tools to prevent COVID, the CDC cut isolation. Viral-laden particles are rampant in poorly ventilated public spaces. We need building codes that regulate indoor air filtration and ventilation systems to reduce airborne pathogens. We need masking. We need masking, especially in healthcare and transportation. We need a COVID awareness campaign. It's long overdue. CDC should feature long haulers to encourage people to vaccinate, wear a mask, and isolate. Unfortunately, because our government hasn't publicized about long COVID, most people don't know that COVID can cause lasting damage to most of our organs. If Americans learn the truth causing the death, and that COVID can trigger a wide array of chronic diseases, most likely they will take precautions. If our government isn't committed to preventing COVID transmission, it is not committed to ending the long COVID crisis that's mass disabling Americans. Thank you. Now I would like to introduce you to Dr. Angelique Corthals. She's Associate Professor for Pathology, Biomedicine, and Epidemiology, Biological and Forensic Anthropology at CUNY John Jay College of Criminal Justice. She also works with Doctors Without Borders as a consultant on diagnosis, treatment, and vaccine healthcare and medicine for all. Dr. Corthals received 2 National Science Foundation grants to study COVID-19. We are grateful to have a biochemical scientist who knows the danger of this very unusual virus as our speaker today.
Hi, everybody. So honored to be here and talk to you a little bit about, the problem with long COVID. First of all, I want to talk about public health is about educating people on diseases and prevention for the benefit of all, not just the privileged few who don't have comorbidities, right? It should not fall on the vulnerable to carry the burden of prevention on their shoulders. Politics should never enter science, and especially not public health. The CDC should never be directed by interest other than that of the well-being of everyone. We do not demand mandates and restriction. We demand education and the truth that COVID is still circulating unchecked, the truth that we have the means to mitigate without restrictions, the truth that COVID is not a cold, it's not the flu, but a dangerous, debilitating, chronic disease-causing virus. And the truth that you cannot talk about herd immunity when 1,000 people die every month and thousands more get long COVID. We do not ask that people be restricted in their social life. We do not ask that they be restricted in their everyday lives. But we ask that they be given all the tools to make the best decisions for their health and that of their community, because an educated person is a force for good. We demand that our emergency tools be improved and that research be funded for the treatment of long COVID and for better prevention of future pandemics that we know are going to come. We demand to evolve and not regress to a past that will never be the same. And now I'm going to go in a little bit of a tangent, but hold with me here. H.G. Wells, in his Time Machine, wrote about a world in a state of absolute permanency, maintained with an iron fist by corporations so that slowly but surely the population no longer has to think for itself. He wrote, "There is no intelligence where there is no change and no need to change." We here do not demand to settle for the absolute permanency of repeated COVID infection. We are intelligent and strong, and we demand change. It is intelligent to wear a mask. It is intelligent to have clean air in public spaces. It is intelligent to share a vaccine, treatment, and diagnostic technology with all. It is intelligent and essential to fund research for long COVID. As many once stood here demanding AIDS treatment, so do we stand now for long COVID and demand recognition. We demand treatment, not erasure. We demand mitigations, not infections. Thank you.
I think the storm is here with us. The storm is coming and bringing change. We are going to speak up together for change. Now I would like to introduce you to Dr. Linda Green. Dr. Linda Green is a retired internist and medical oncologist. She's an active member of the American Public Health Association, grandmother of 6, member of PAN-ANDIT, and COVID Safe Maryland, also medical advisor of MaskTogetherAmerica.
Thank you for inviting me to speak today. I've had the real privilege of working with MaskTogetherAmerica, PAN-ANDIT, COVID Safe Maryland, the American Public Health Association, and a number of struggles over my lifetime. Their work with the most recent groups of disability activists has informed much of what I want to share today. Also, my years of activism have convinced me that we have to build a broad, multiracial, and militant movement that brings in all parts of the working class. Fighting for disability justice, just like fighting racism, benefits everyone. All people can contribute skills and experience to building a better society. So why does this not happen? It is impossible to discuss long COVID mitigation and treatment without understanding how capitalism views healthcare for the majority of the population. First of all, capitalism operates above all to generate profit for the ruling class of industrialists and financiers. To this end, it needs people to be just healthy enough to work for them and to fight their wars. Those who are most valuable to their system receive better health insurance and programs to keep them healthy. If it was up to the capitalists, there would be no need to take care of chronically ill people, people with disabilities, long COVID patients, and the elderly. But this default position of the ruling class has been challenged by mass movements against racism, war, and poverty. And so the capitalists have grudgingly provided some health care for various groups. The creation of Medicare and Medicaid emerged from the civil rights movement, for example, and included the anti-racist demand of integrating our hospitals. Today as well, anti-racist struggles can be merged with disability justice issues to strengthen our position. Some of us are looking at ways to look at the prison health system and long COVID as well. COVID-19 helped many people understand more about the system's values. Old people, Native Americans, and Black and brown essential workers in transit, education, and healthcare, and many others suffered and died disproportionately. Triage in the emergency room included value judgments about quality of life by doctors and nurses who never knew anything about the patient in front of them. Patients who were old or had disabilities were judged to not have a life worth saving, a statement that echoed the Nazi medicine of Hitler's Germany. I think it's interesting that some folks in the government seem to realize that these ethical questions are important. When Section 504 requested comment on the type of judgment and triage, there was quite a bit of response. However, the methods and accessibility of SSDI show that this is mostly a sham, as long COVID patients find support in this area to be very difficult and consider a myth. Limited accommodations in the universities and workplaces have become the norm. Tailoring medical practice to include safety measures for COVID and appreciation of the reality of long COVID are surprisingly difficult, as many here can attest. In addition to denying treatment to millions of workers in the United States, the capitalists distort research in the name of profit. The pharmaceutical industry has benefited from payouts and protection for vaccines and pills like Paxlovid. This industry is the most profitable in the United States. But, it's also quite expensive to the capitalists. So therefore, they don't really want to spend too much of that money on people with serious illnesses unless they are very valuable to their system. Research is tailored to creating treatments for diseases that affect large numbers of people that may have many things less severe than long COVID, but where there is profit to be made. Mitigating COVID risk for the population with improving ventilation in schools and offices is an expense not worth it to the capitalists because workers can be replaced. They also think there will be enough children to provide a new generation of workers and soldiers. Research funding and pharmaceutical solutions constitute another fight which many of us have been involved in. There is one more dimension to the struggles against capitalism. This is in the international arena where regular people all over the world are struggling against imperialism. While the ruling classes fight over oil and other resources, the working classes suffer. The genocide in Gaza is the most current example, and the disability from injury, malnutrition, and infectious disease, including COVID, are horrific. The profiteering seen in the COVID vaccine rollouts was most obvious in the fact that rich countries had it and others did not. Protests of the World Trade Organization went unheeded. Building international solidarity for health is a critical agenda point. So the fight for a world where resources are shared, all are valued, equity is the rule, and everyone has a chance to contribute is a huge task. Broadening the struggle to include disability justice, along with the fights against racism and sexism and ageism, are important to win reforms and ultimately revolutionary change. Today, this event is a move in the right direction. Thank you.